everybody in here has heard of penicillin before, right? Tell me about it. It's the number one prescribed antibiotic. Why? What do they prescribe it for?
Everything.
Everything. All right, so if it's everything, name three things. Strep. All right, strep, what kind of infection is that? What kind of, huh? Throat, so upper respiratory. So it treats upper respiratory.
And then toothaches.
Oh, ear.
Oh,
Some STDs. You said,
toothaches. The infections.
all right.
That's about the only thing I really remember.
All right, but it's mainly prescribed for respiratory infections. That's why kids get it all the time, right? Amoxicillin and all that kind of stuff. They got bubblegum flavor now, right? So, how do I know if a medication is a penicillin? What does it have at the end?
Penicillin.
Penicillin. So, amoxicillin. Any type of cillin at the end, I automatically know it's a penicillin. So if I were a student, which I was, and I had to study about penicillins, I would study all 100 medications individually. I would understand that they all end in cillin. So no matter what they put on the test, if it says cillin, I automatically know it's a penicillin. Make sense? There's another thing about penicillins. What did I say? If they're gonna be allergic to stuff, what they gonna be allergic to?
Penicillin.
Penicillin. So this is one that's allergy prone. All right, so a lot of patients have allergies to penicillin. Itching, hives, right? That's the real signs and symptoms of an allergy. They have itching, they have hives, they have swelling. Their throat may start itching, okay? Rash, okay? So when I think about penicillin, I think about, they treat all this, but a lot of times it's respiratory infections that it treats. Upper respiratory, ear infections, strep, all that stuff, okay? A lot of people are allergic to penicillin. What's the type of allergy they'll have, or the response they'll have? Itching, hives, rash, swelling, okay? Difficulty breathing, okay? But mostly penicillin is very well tolerated. All right, a lot of times the reason why allergies develop is because they're getting it too young when they don't need it. All right, because we think about kids again, not every snotty nose is from a bacteria.
Right.
Most of the time it's from a virus. But a lot of times parents don't want to hear that, right? Oh no, you're gonna write me something. Okay?
Well, I was one of them.
You were one of those parents?
Yeah, because every time that I bring my kids really sick with a high fever, it's virus, it's a virus. And I tell my parents, everything's here is virus.
Well,
But
there's like a whole lot of different cold viruses.
Yeah.
And it's easy to catch a virus because people sneeze and then touch the table. So people like sanitize and stuff, but you know what they forget to sanitize? Like the keyboards, the phones, all that stuff that we touching all the time, right?
Yeah, that's why after COVID that everybody was using sanitizer, no, the kids wasn't sick too much.
Yeah,
Well,
now,
I guess so.
now we're back to being comfortable again, okay? So y'all, another thing with penicillin. How many people had a child that had to be on penicillin? Everybody, right? So, how'd you give it to them?
Orally.
Orally, all right? Did it get like a liquid?
Yeah.
All right, anybody got a pill before?
Not for a child.
Okay. So, any adults with a pill, what you drank it with? Or what you took it with?
Milk.
Guess what you're supposed to take it with?
I took it with milk.
We're going to take it with water.
Plenty of water.
Take it with water. Okay? That's important. Take it with water. So a lot of times, patients are like, I'm giving my children the penicillin, and they're not getting any better. Or, I've been taking this penicillin, this amoxicillin for as long as you said, I'm not getting any better, so I'm going to go ahead and do something different. All right? The problem is a lot of times, we take it with juice, or we're taking it with milk. You're supposed to take it with water. When you take it with milk, guess what milk does? It kind of
Decreases
breaks down
the effect.
penicillin, and it makes them more susceptible to developing a penicillin allergy. Yes.
Well, how come it says sometimes to take, you can either take it with food or with milk?
It depends on what class of antibiotics. Penicillin is what, not that class. Okay, penicillin, you should not take it with milk. I mean, you can, but it's gonna break it down. It's gonna make you more prone to developing a penicillin allergy. You shouldn't take it with juice either.
For kids. For kids.
For kids, right?
For kids.
Because what do we
I'm
do?
a bad mom.
It's nasty, and we hurry to give them some juice, or we give them some milk behind it. But the problem with juice is the acid in the juice breaks down the penicillin as well. Okay?
But I didn't know that some of the nurse in my doctor's office, my kids, they didn't tell me that. So I just learned it now. So for my kids.
They just reading this chapter.
Yeah, so like for my kids, I almost killed them.
Well, no, we're not gonna say that, all right? But how many people look at their discharge paperwork that they get from the doctor's office?
I
You
do.
don't look at it? But
I
you know what
do.
they put on there? That they educated you,
Yeah, and they
I
know
don't
the,
read it.
and that's a problem.
yeah.
We gotta start reading those things because they document that they educated us. So if we ever go back and say, well, I didn't know, blah, 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 they're gonna pull out their documentation and say, no, we educated you. Make sense?
Yeah.
And then whenever you go to the pharmacy, I know in Deja has already told me, wait, did you sign it? Was that you? Told me you throw the paper away?
Yeah.
Okay, yeah, see. When the pharmacy,
I throw it away at the pharmacy.
so that paper gives you all this information, so they're covered again. And then now they make you sign something on the little thing, you know what you're signing?
No, I just signed it.
Y'all just be lying.
I read.
Press decline, but I'm like, all right, well, that was gonna be okay.
Look, Dr. Thyssen, I'm gonna tell you, I saw a documentary that's why I started reading. They had a little project they did where they had people signing stuff and they didn't know what they were signing. People were signing away their estates, their lives, their children, like literally. And so it was an experiment just to show that people really don't read what they be doing. So after I saw that, I was like, if I don't do nothing but at least skim through it, I'm gonna read now.
So they say there's at least one lie that everybody tells. And that lie is, I have read.
All-
understood. That's the lie. All right? So a lot of times at the pharmacy, they're asking if you need patient education or if you receive patient education, we sign it. Okay? But y'all, that little sheet of paper, that little piece of paper with all them 85,000 words on there, is telling you everything you need to know about that medication. Okay? So penicillin, what we gonna take it with? Water.
Or wine.
Here she go.
Conversation. I'm saying that. You know what? It's gonna happen. All right. Water. Okay. Y'all start doing that and watch how much better the kids get or how much better you get. Okay. Water. All right. So what's the big thing with penicillin? What's the big thing with penicillin? We know that it treats a lot of stuff.
It's a big old pill.
It can be a big old deal. It can be, yeah.
It's mostly
Hydrated and
all the time used to treat upper respiratory.
Mostly for upper respiratory infections, so we think anything, the neck up, so ear infections, strep, that sort of thing, okay? Can be used to treat STDs, some STDs, okay? The big thing with penicillin, we're gonna take it with water. What we taking it with?
Water.
What we said?
Water.
Now you can take it with food as well, but food is not gonna let it be absorbed as well. It's still okay because it does cause some stomach upset, but it's best taken on an empty stomach. But can you take it with food?
Yes.
Yes. Milk,
No.
juice.
No.
What we taking it with?
Water.
Message.
And only penicillin is the only one that's best to take on empty stomach?
No.
That's a text exam. A question.
Test question it is. All right?
With water.
So, here's another thing about penicillin. If a patient is allergic to penicillin, guess what they're also probably allergic to? Cephalosporin. Okay, because they are both beta-lactam antibiotics, and that just means their molecular structure. They all have this like beta-lactam ring. LACTAM, beta-lactam ring.
I'm sorry, say that again?
LACTAM. BETA, beta-lactam ring. All right? But the main thing is, if a patient tells you, you know, I'm allergic to penicillin, what's the first thing you're gonna ask them? If somebody tells you I'm allergic to penicillin, what you gonna ask them?
What's the reaction?
What's your reaction? Okay, message. All right, that's the first thing you ask them. I'm allergic to penicillin. Okay, what's your reaction? Okay, if they say they have hives or something like that, then they are also probably allergic to cephalosporins. Okay, so let's say this is a test question. A doctor has prescribed ceftriaxone, which is a cephalosporin, to a patient with a penicillin allergy. What is the nurse's first response?
What is your reaction?
What is your reaction? Okay, because we need to make sure it's a true penicillin allergy, right? Because if they say my stomach hurt, is that an allergy?
No.
No. Can they get this medication?
Yes.
Yes. But if they say, right. If they say, oh, I started getting hives, can they get that cephalosporin?
No.
No. Make sense? Message. All right.
So question. So since cephalosporins and penicillins are all considered cell wall inhibitors, just because they are allergic, I guess, maybe to like penicillin, for example, they wouldn't be considered allergic to like vancomycin?
No, because vancomycin is not a beta-lactam antibiotic. All right?
See, I guess I was under the assumption that because they were like in the same class with cell wall, that they were allergic to one, and then they would possibly be
It's only because they're molecular, so that doesn't talk about their molecular structure. The beta-lactam ring is their molecular structure, so it's just like little ring,
Okay,
that's how they're made. That's what makes them very similar.
okay,
It's like being twins.
okay.
Make sense? All right, so there's something important so any question about penicillin?
Are there any more beta-lactam rings?
There's carbapenems, all that kind of stuff, but patients rarely get those. So I'm going to teach you the most commonly prescribed antibiotics, okay? And then when you get into like those med-surg classes and stuff, they'll go into detail about those specific infections that need very specific medication. Make sense? All right, questions about penicillin? Does everybody understand? What's the big thing with penicillin? Upper respiratory infections. What else? How are you living it? Water. Can you take it with food?
Yeah.
All right, there's a lot of allergies, right? What's a true penicillin allergy?
Hives, itching.
Swelling.
Okay,
Not nausea, vomiting, diarrhea.
no, that's all of them. Every single one. All right, if you're allergic to penicillin, what else are you allergic to? All
Cephalosporin.
right, so let me tell you about cephalosporins. All right? So cephalosporins, so penicillin, that's suffixicillin, cephalosporin, their prefix is gonna say ceph. It's either CEPH or CEF, okay? So if you see something with ceph at the beginning, I automatically know that it's what medication? Cephalosporin. And if they're allergic to penicillin, can I have this medication?
No.
No, all right, so whenever we're thinking about cephalosporins, we're gonna think about Ceph the giant.
And a mango nut.
You got a magnifying glass. Oh.
Is that better? Can y'all see it? All right, so whenever I think about cephalosporin, who am I thinking about?
Ceph the giant.
Ceph the giant. So GIANT tells you everything you need to know about cephalosporin. All right, the G stands for GI. You're gonna have a lot of nausea, vomiting, diarrhea. All right? So since I'm talking about that with a cephalosporin, that means it's a lot of it, right? Because they all do that. But cephalosporins, they're really gonna have a lot of nausea, vomiting, and diarrhea. Make sense? All right? The I stands for increased glucose. So what does that mean for your blood sugar? It's gonna go up. So somebody that's on a cephalosporin, what are we also checking? Their blood sugars, okay? Make sense? The next one is A, anaphylaxis, which just means allergy, right? Because again, if they're allergic to penicillin, they're allergic to cephalosporin, okay? There's something else on there. It says alcohol. So A stands for allergy or anaphylaxis. It also stands for alcohol, okay? So what that means is they cannot have alcohol. Wait, come, let me, hold on. Wait.
Oh, yeah, you need to get right there.
Okay. Endanger. Oh, I just thought of something cool. Endanger. You're gonna be in danger. Taking cephalosporin with alcohol, okay? All right. So on the test, you're gonna remember that I had to walk my behind back here and tell in danger that she's gonna be in danger if she takes alcohol with cephalosporin. Okay? So what happens when they take alcohol? They're gonna have profuse, uncontrollable vomiting. Okay? And that's any alcohol. So they have a mouthwash with alcohol in it. Guess what? They're gonna vomit. If they take an elixir, because we know elixir has what in it? Alcohol. They're going to vomit. Okay? So my patient education has to teach them about all types of alcohol, right? Make sense? Am I talking about rubbing alcohol? No. I'm talking about what they ingest. Okay? So endanger. Can you have alcohol with a cephalosporin?
No, I won't drink that.
Because you're gonna be in danger of vomiting profusely.
Not with that.
Okay? All right. Cephalosporins have what as the prefix? Ceph. So if you see a medication on the test or in practice and it has ceph as a prefix, I automatically know, wait a minute, that's a cephalosporin. I need to think about Ceph the Giant. GI, they're gonna have a whole lot of nausea, vomiting, diarrhea. I, their blood sugar's gonna be up. A, I need to ask them about allergies because they could possibly be allergic to penicillin. And if they're allergic to penicillin, can they have this? No. A is also alcohol. What do I need to teach them? No alcohol, none. None of the mouthwash, no elixirs, no alcohol, none. Okay? N stands for nephrotoxicity, which means it's gonna be really hard on their kidneys. Okay? So a question I need to ask them is, are you having difficulty urinating? Okay? That's the first sign of nephrotoxicity. Okay? So I'm gonna ask them about their kidneys.
So would you prescribe this one to anyone who want that?
You tell me.
No.
No. Message. All right? All right, T stands for thrombocytopenia. What does that word mean? So it means decreased platelets. And if you have decreased platelets, what are you at risk for?
Bleeding.
Bleeding, because you don't have the platelets. So they're gonna start bleeding, all right? So we wanna teach them signs and symptoms of bleeding. Like, so they gotta use a soft bristle toothbrush. I'm supposed to write this down. What's right? Soft bristle toothbrush. If they start having blood in their urine, is that a problem?
Yes.
They need to contact a provider about blood in their stool.
Yes.
Okay? Make sense? So, cephalosporin, what am I gonna think of?
Ceph the Giant.
GGI, whole lot of nausea, vomiting, diarrhea. Okay, I, that blood glucose gonna go up. Check their blood sugar. So what does that mean for a diabetic?
They monitor.
I automatically know that glucose gonna go up, right? So what should we expect? High blood sugars and more insulin. Okay, if they're in the hospital with a cephalosporin, we automatically know we're gonna be doing acne checks and we're gonna be increasing their insulin. Okay, make sense? All right, A, anaphylaxis or allergies. So what should I ask them? Are you allergic to penicillin? Because they may have never been on this medication before. But everybody knows about penicillin. All right, so we ask them, are you allergic to penicillin? If they say yes, what's my next question?
What is your reaction?
That was not the right question. What was it again, Michelle?
What's the reaction?
What is the reaction? thought we had, okay, all right.
Lost of disconnection.
It was, yeah, it was gone, it was
She just
gone.
wanted to know if they were gonna be drunk off that liquor.
Cause she went back to that A
Yes.
for alcohol. Okay, gotcha. So you was really talking about endangered back there, right? I got you.
Some patient.
Gotcha. Some patient. I promise I am not gonna name the patient in danger on the test. I will not do it. I may just say danger. Okay? All right. And nephrotoxicity, what does that mean? Kidneys. So I'm gonna ask them.
Okay, they urinate normally.
Are you having issues urinating? No, urinate normally. Okay. And then thrombocytopenia means what?
Bleeding.
Decreased platelets, so they're at risk for what? Bleeding. Make sense? Questions?
Are you asking about the color of the urine?
You could, because what did the color tell you?
Dehydration. No?
Okay, that could tell me dehydration.
Whether they're bleeding.
Or if there's blood. That's why I thought she was going with that, you know.
So, for the cephalosporins, they would be prescribed for the same things like upper respiratory. So septicemia falls in that category too.
Because they're very similar.
Right.
So, another thing about cephalosporins, right, y'all heard of Rocephin, right?
Yeah.
That's a commonly prescribed medication. What they used to give Rocephin for?
STDs.
Ear infections, what else? STDs, all right, so it's the same indication as penicillin, okay? Percent?
No, I was talking to.
So wait, Rocephin fall under which one?
Cephalosporin, that's a trade name for ceftriaxone.
Oh, cause it has a septic in the.
That's a septic, yes. Cephalosporin. See? Don't study all the 100 drugs. Focus on the similarities in the suffix or the prefix, and then go from there. Another thing about cephalosporins, they're also given prophylactically when people have surgery. Okay?
Oh, okay, and it's probably why.
Cause I was like, they gave me something, I was getting ready to go in and have a C-section, and then I immediately started breaking out with it. And I was like, I ain't never been allergic to the penicillin, but she was like, yeah, well, you're not gonna be able to take it no more, cause it was high, itching. It took 24 hours to get out my system.
It took how long?
It was about 24 hours, cause I mean, they
Why do you
gave me-
think?
Huh?
Why do you think?
I mean, I'm just.
Come on, let's come on.
I'm-
Bring it out. How long it took to get out your system?
It was like at least 24 hours.
Okay, pause. What stage of pharmacokinetics is that? Medicine getting out of your system?
Oh.
Elimination. What's the key organs in elimination? Kidneys. What does cephalosporins do to your kidneys?
Okay.
Come on.
That was the mic. Y'all see that? Yes. So y'all see why I teach antibiotics a little differently. I focus on what y'all know so we can pull it out. Okay? So yes, cephalosporins are used prophylactically when you go to surgery, because when you go to surgery, you're at risk for infection, right? Because they couldn't. Okay? So a lot of times the order will say on call to surgery, which means you're getting it on the way to surgery or right before you get the surgery done. Make sense? Questions about cephalosporins? Endanger. Can you have Merlot with that? With, what about
Girl, don't ma'am, not the Four Loco.
okay,
Take you to the king.
yeah, I'm gonna say, what about Bones Farm?
No, they had it out.
What about what's that popular mouthwash they always have on?
That's the one that was like,
What?
No, they definitely can't have that. If the mouthwash burns when they take it, it's got alcohol in it. Can't have it, okay? Make sense? So what if the patient says, well, I need mouthwash? What can we advise them to use? Alcohol free. Or like peroxide.
Peroxide.
Yeah.
you think they want it for the cleanliness or the smell or taste in my, why do you think they need it?
Sometimes patients feel like it ain't gonna, unless I feel it, it's not working. Anybody here should get relaxers?
I don't feel it burning.
If it ain't burning, it
It
ain't
ain't
working.
working.
Yo, people so crazy.
You gotta be tingling a bit. Wait till it tingle, then you know it's ready.
Look. That's when you learn how to lie. Yes, it's burning. It's burning. Cause they'll let it sit on there looking, and they tell you on there clearly, do not leave this on for longer than 20 minutes or
That
so.
water hit it, you be like, scalpel tender.
Alright, questions on penicillin? So, because you know that cephalosporins and penicillins are very similar, what we gonna take a cephalosporin with?
Water.
Water. You're so smart. Alright, we gonna come on back here to vancomycin. Try to go in order of them. But y'all know those two like the back of your hand, right? Vancomycin, everybody got more?
That's what I didn't see them either.
I told them to be walking all around today, so you gonna remember, okay, when she was in the back of the class, she said, like, y'all, like, that really helps, like, remembering. All right, so, everybody heard
We all that
vancomycin.
like that for the data test. Oh, we ain't gonna be in here.
No, you're not. So, vancomycin, everybody heard of this medication, right? What's it used to treat?
Infection.
Okay, that's, yeah. So, vancomycin is usually used to treat those bless you, those
Thank you.
resistance